A traumatic brain injury is caused by a bump, blow, or jolt to the head, or by a penetrating head injury that disrupts the normal function of the brain. Not all blows or jolts to the head result in a brain injury. Most brain injuries that do occur each year are mild and are commonly called concussions. Concussions are a risk factor in many sports. Questionnaires and protocols are used to recognize and treat concussions to ensure complete recovery before returning to work, to learn, and to play.
The question is, how do we evaluate and how do we identify a concussion on the field? Athletic trainers are trained to recognize a concussion when it happens on a field. Some of the primary symptoms of a concussion are really headache, dizziness, nauseousness. If any of those are positive, then you have to assume it's a concussion. Once they have a concussion, then they have to follow through the protocol. Here's a stepwise approach on how this person's going to return to play.
No sport is 100% safe. Someone has to have an individual discussion with either their physician or with a team physician or with a coach and understand the risks of those sports and then make a decision as to whether that level of risk is acceptable to them or not.
In addition to the existing protocols, health professionals continue to research the best way to know when it's safe to return to normal activity.
If you do get a concussion, we want to see how your brain's working, and when it gets back to kind of where you are now, that means it's okay to go back into sports. Today we were doing some pre-screening for concussion, and what it is some neurocognitive tests that the students will go through to get a baseline on what their mental functioning is like, their cognitive functioning.
We use a system called IMPACT, which is the standard in the industry for concussion baseline testing. It's a neurocognitive test that we use to evaluate the brain's function. The issue is, how do we get to the athlete to do that baseline? And so we do have a program where we will go out to the high schools and we will deliver the IMPACT testing for free.
When a student is ready to return to function, return to play, return to practice, if we test a student and we see that they have not achieved back to baseline, that means that their brain is still in recovery. We do the screening for as many sports as we can at the school, and typically we're looking at risk of collision. For example, we screen the cheerleaders. We screen soccer. Soccer is the #1 sport where women get concussion. We have other sports that come in, volleyball, basketball. We've done lacrosse, field hockey. So it's really those sports that do have risk of head injury.
Concussions have become a very serious issue in football. I think taking the test, getting the education, having the doctors talk to them, being part of the physical is huge.
The benefits that a student gains from athletic competition is immense. We know that they are healthier. We know that they actually perform better in school. We know that they get in less trouble. I think as we gain more information, perhaps through research, perhaps through studying what's going on with sports and athletics, we can try to make these sports safer.
Without that research, the testing, the doctors, the trainers on the sidelines, there's just, we can't go back to how it was before.
We know as much as we do about concussions and about health in general because of people just like you who have volunteered for research studies. Everyone in our community can get involved, including those who are perfectly healthy and those with underlying health conditions. We invite you to help. For more information, contact your local research university or visit researchmatch.org.